If you find your child to have this kind of rash, come to hospital immediately. I had a 10-year-old child with no comorbids brought to the hospital because mother noticed some small rashes all over his body. He denied any recent infection or injuries. On examination, there are generalized pinpoint rashes all over his body which are not blanchable, raised or itchy, and besides he has multiple bruises. This rashes is known as Petechiae, which is due to a blood leakage from a tiny blood vessels under the skin, and it always indicates low platelet, and his first full blood count reveals a platelet of 2. This chart shows a normal platelet level and thrombocytopenia. As you can see, 2 is extremely low, and doctors often refer this as a single-digit platelet. The next step is to rule out leukemia, and thankfully his hemoglobin and white blood cell were normal. The peripheral blood film were consistent with a true thrombocytopenia with no blood cells seen. He has no clinical features to suggest leukemia, such as loss of weight and appetite, fever, enlarged lymph nodes, liver and spleen, or testicular swelling. He was diagnosed as acute immune thrombocytopenia and was started on infusion of immunoglobulin. His platelet level remains in the single digit within the 72 hours after IVIG, and then it slowly increased to 12, and as soon as he reached 47, he was discharged. A week later, the repeated platelet rose more than 100. Although ITP is not so common, but it may happen to anyone, so if your child experiences petechiae or bruises, please consult a pediatrician immediately.